Welcome to the panel, Improving Mental Health Among Gay, Bisexual, Queer, and Two-Spirit Men, Insights from Qualitative Research. So we have an hour and a half, and we also have only 3 presenters today. So I'm going to have each presenter speak for 20 minutes. And then if there are questions right away, we can do those. I'll be in charge of time, so please remember I'm a nice guy most of the time, even when I tell you to stop talking, not you guys. Yeah, so we should have plenty of time for comments and conversation as we go along, so that's great. Okay, so first up is Olivier Ferlatte from the UBC. Dr. Ferlatte is a postdoctoral research fellow with the Men's Health Research Program at the School of Nursing at the University of British Columbia. He has over 15 years of experience working in sexual minorities' health and promotion. His research focuses on the relationships between marginalization, violence, and social and health inequities among sexual minorities. Dr. Ferlatte is the co-director for Still Here, a photovoice research project investigating suicide among GBQ2S adults. Please welcome Dr. Ferlatte.
I don't know how that worked.
I'm going to turn this off. If somebody needs it, come get it.
So hi. Okay. Wow, there's a lot of people. Mental health is popular. Thank you so much for attending our session. Oh, some people don't like mental health. Okay, so I'm just happy to be here and doing my presentation today. But before I start, I just want to acknowledge that we are on the unceded traditional territory of the Musqueam, Squamish, and Salway people. Today I'm going to talk to you about some work that I've been doing in my postdoctoral fellowship, looking at the issue of suicide. I don't believe that this crowd needs more convincing about why we need to look at this issue, but in case you do, here's a few statistics. Several reviews have confirmed that, gay and bisexual men and two-spirit men are at increased risk of suicide, and including a systematic review conducted by Travis that showed that gay and bisexual men are 2 to 5 times more likely to attempt suicide in their lifetime in comparison to heterosexual men. In Sex Now survey, in a study that we published, we find that 1 in 6 Canadian gay and bisexual men, consider suicide in the past year. This exceeds the rate of suicide ideation of the general population of men over an entire lifetime. Also, highlighting the urgency of looking at this issue more deeply is the fact that now suicide death has surpassed HIV/AIDS death among gay and bisexual men. The main hypothesis in the suicide research literature for this elevated rate of suicide among gay and bisexual men is homophobia, which gay and bisexual men can experience either by through experiences of violence or through internalizing those feelings, internalized homophobia. Well, this has been put forward by a lot of research reports looking at the relationship between experience of violence and homophobia and suicide ideation. And while this research has highlighted an important issue that probably needs to be addressed, it has a few issues, mainly because it has only been done to quantitative research that has looked at the association between those and has not actually considered how gay and bisexual men perceive the cause of their suicide ideation. One exception to this work is the work by Wang in Switzerland, who actually asked on a survey, why do gay and bisexual men who have attempted suicide, what do they believe was the cause of those suicide attempts? And as you can see, there was a lot of different reasons why people actually attempted suicide, but those are the top number 5. And actually problems with being gay that included homophobia, both experiencing homophobia from other people, but also internalized homophobia, was only the main reason for 16% of individuals. This research, because it was a survey, did not really understand the complexity between the relationship of those determinants. Also, the problem with the kind of having homophobia as the catch-all answer for suicide ideation among gay and bisexual men is the fact that it actually does not consider inequities within gay and bisexual men. It provides actually a very distorted view of the gay community, like we all have a unique experiences, and there's no differences within our community in terms of how we experience life, but also suicide across different social locations. One example from this work is work that we conducted with the Sex Now survey that actually using intersectionality to try to look at within gay and bisexual men who are gay and bisexual men who are at increased risk of suicide. And actually we find that there was 3 groups that had elevated risk of suicide among gay and bisexual men in Canada. One of it was bisexual men partnered with a man. So those men were more at risk of suicide in comparison to gay men, but also bisexual men that are partnered with a woman or that were single. We also find that Indigenous men were at increased risk of suicide in comparison to the rest of the sample. And we also find that men who reported a low income and also a low education, so they had not gone to university, were at increased risk of suicide. And it's important that in our survey we find actually that you needed both. So what this really eliminates is the importance of considering other issues beyond sexuality when we investigate suicide among gay and bisexual men. To try to better understand how gay and bisexual men understand their suicidality, and also to kind of look at what are the different factors that may actually increase someone's risk to suicide, we launched a qualitative study named Still Here. Still Here does not look like a traditional qualitative study, as we use photovoice, which is a technique that's been used a lot in community-based research to draw attention to issue of interest of different community. So what we did with the project is we worked with gay and bisexual men with a past history of suicide and provided them with cameras. And then we invited them to go take photographs that depict their experience with suicide. So they could take photo about whatever they wanted. There was a way for them to express themselves on the topic. So they could take photo about what triggered their suicide ideation and how they managed their suicide ideation, or just their perspective on the topic. Using this technique is has a few advantages. One of it is that people can actually express their story about something that's very difficult without relying on words alone. But also what it does, it also, using this technique, also actually disrupt the power dynamic that usually exists in research, where the researcher is asking question and the person has to answer within that question. Differently, in that study, what people did is that they decided with themselves what was meaningful and important to them about their experience, and they took photo about that. And then they came back, and then we interviewed them looking at those photos. And in the research, the interview is very different than a typical research interview, because the interview is about people describing their photos. And then, so it gives power and control to the person, to the actual participant. And our goal with that is to offer new insight about the social determinants of suicide for gay and bisexual men and two-spirit men. So we had 21 participants in our study that took photos, and they contributed over 200 photographs that depicted their experience with suicide. Although it was not it was majority gay men, we also had bisexual and two-spirit individual. We had 3 Asian men who participated and 3 Indigenous men. About half was single. And in terms of employment, about 7, a third were employed, while others were self-employed, unemployed, or on disability or retired. And the requirement was that people needed to have a past history of suicide thought, but 15 actually had made a suicide plan at least once in their life. 11 had attempted suicide, and 14, so 2/3, actually sought professional help for their suicidality. So a third did not get any kind of support. Then we have all those photographs and those data from those interviews that were recorded as material to analyze, and we're doing a thematic analysis kind of inspired by intersectionality, that by looking at what are determinants of suicide and how those relate to different aspects of identity. And we find that there was three main reasons why a self-perceived cause of suicide among our sample. One of it was violence, one of it is a feeling of being disconnected, and the third one was hopelessness. Violence was a very prevalent theme across all participants. Many had experienced violence at different points in their life course, but actually, but more importantly, the majority had experienced violence in their childhood or in their teenage years, really highlighting some very challenging start in life that had a very profound impact into their childhood and adolescence, but also that a lot of men saw as the reason of a lot of their difficulties in adulthood, including suicidality. Violence could take many forms. For some participants, it was experience of abuse within their family, like from their parents or other siblings. But the most common form of violence that was reported by participants was experience of violence within the school system. So violence, homophobic violence from other male students. This was the example of the person who submitted this photo, which is the photo of the school that he went to, and he captioned it where it all started, to kind of signify how was the beginning of all this trouble with suicide. This student was, he described in the interview about how he had been experiencing both physical and verbal violence and even sexual violence every day in his school, every single day. He ended up quitting school when he was 16 to escape what he described as hell. And then he developed a lot of different mental health problems, including severe depression and anxiety, and also he was diagnosed with post-traumatic stress disorder. For him, this violence destroyed his life. Violence was very elevated among the three indigenous participants that we had, and they really saw connection between both their sexuality but also their indigenous identity as being related to their suicidality, but also their experience of violence. One of the participants actually took a photo of a totem pole because he wanted to signify to the study how important his indigenous identity was so important to him. This person had been sent to a residential school as a child where he experienced a lot of violence, both physical, emotional, and also sexual violence. And then when he returned as a teenager into his reserve, he also experienced elevated violence from people in his community as he was coming out as gay and two-spirit, because through the processes of colonization, the history of two-spirit people had been erased within his community, and therefore people did not really understand or appreciated his two-spirit identity. Another feeling that was very important, another determinant of suicidality that was described by many participants was this feeling of being disconnected, of being isolated, and feeling like an outsider. These feelings often started very early in the life of the participant in their childhood, but really amplified during their teenage years as they were bombarded with anti-gay messages that gay was dirty, that gay was wrong, that gay was something that you didn't want it to be. This was a photo taken by one of our participants who described some of those feelings of how he felt really disconnected when before he did his coming out, because he was feeling he couldn't be his true self with his family and his friend because they would not accept who he was. He felt like an outsider, but at the same time, the closet prevented him of building a social network where people would be able to accept him as well. Also, what was another theme that was important among our participants is that this feeling of disconnected was also often their mental health issue or their suicidality in and on itself actually led to them feeling very disconnected. This photo was taken by one of our participants, and he took this photo of this alleyway, and he described in his interview how when he went to his friend and talked about his depression and his mental health, they really made him feel like garbage. A lot of this friend actually stopped calling him or distanced himself from him. And then, so it was kind of like, okay, so experiencing social isolation a second time because of their mental health status, speaking to the importance of mental health stigma and the experience of suicide of gay and bisexual men. And then another theme that was very important in the story of a lot of the participants was hopelessness. A lot of our participants actually experienced a lot of hadn't said that when they were feeling suicidal, it's because they didn't see themselves as having a future, and they were very uncertain about being able to actually being able to afford to pay their rent or to live their life. So their hopelessness was really related to often to their socioeconomic status. This photo was taken by one of our bisexual participants. And he took this photo of and he had recently lost his employment, and he took this photo of this chair, which he said he spent like countless hours worrying about finding work and worrying about finding a job. What is different for this participant, too, is that he was the only one partnered with a woman. He was partnered with both a woman and a man, but there was some expectation within his heterosexual relationship that he needed to be the breadwinner of the family. So that really amplified his feeling that, he needed to kind of have a job, and that provided a lot of stress for him. Although other people may not have had those responsibilities. A lot of gay and bisexual men in our study who experienced failure in the workplace or in their career also describe a lot of feeling of hopelessness because they felt it was, even as a gay man, even if you're not in a heterosexual relationship, there's a lot of pressure to actually perform in your career and to be successful in making money. Also, we have to take into account that hopelessness, although a lot of participants describe it as something related to money and their class, was often tied to their sexuality because of the challenging start that a lot of our participants had in life. A lot of them had abandoned school without completing their education to escape violence, to escape a small town where there was no gay community, where there was a lot of stigma. And then when they left school too early, that had really impacted their capacity to actually make a living and so on. So some summary and recommendation from our study. We are seeing that violence, disconnect, isolation, and hopelessness were the main reason why gay and bisexual men said they've considered ending their life. These determinants were influenced by multiple aspects of identity of gay men, not just their sexuality. So I think what's important is that healthcare provider really needs to be attuned to this diversity of factor, but also really take into consideration a life course perspective where experiences in the childhood may actually influence the trajectory of gay and bisexual men and have a large influence on their mental health and including their story of suicidality. I think, thinking about, we're doing this work because we want to prevent suicide in the community, but we can develop a lot of individual level intervention, but this will never be enough because I think the experiences that were described by the participant of our study were really related to kind of micro level and structural issue that really need to be addressed so to improve the situation of the participant. So therefore, today I presented data on her sample of gay and bisexual men from her study that considers suicide, but still here is a larger and ongoing study. And prior to that, we actually also have a subsample of participants that were gay and bisexual men who had lost another man to suicide. We also just completed over the summer study of queer women, and right now we are recruiting to expand the study to gay and bisexual men living with HIV, a population that is at higher risk of suicide because of the intersection of homophobia and HIV stigma. And actually tomorrow I have a poster on that topic, so come and see me from quantitative data, but now we want to build qualitative data to get the insight of gay and bisexual men living with HIV about their suicidality. So if you work with people that might be eligible to participate in their study, and we'll engage the same thing. We will provide them with camera. We'll ask them to take photo about their experience. We give an honorarium to participant, and that helps us really understand this topic because the issue of suicide among people living with HIV is a highly understudied issue, and we're wanting to kind of bring a bit more attention to that issue. And you can approach me if you have any suggestion about how to recruit, or if you know some people that might be interested to participate. Also, as I mentioned today, I presented 5 photos, but we have a collection now that's like, with all our sample, that's like close to like 600 photographs. So, oh, that's the wrong slide. I'm looking at the next slide. Thanks to your participant and our funder. But then, that's the slide I was at, because you see both on the monitor. I hope I was not wrong the entire presentation, which sounds like something I would totally do. So I just invite you to visit our website where we have more photos of our participants. We also have a Facebook and an Instagram account where we're putting photo weekly of all of our participants. And this is my email. If you have any question or if you want to talk about this, you can always contact me. Also, I have a few copies of a book that we produced from our participant photographs, so that we've put into a beautiful collection with the photo and the captions from the participant. And I have a few copies with me if you'd like to put your hand on one of those. Thank you.
So we definitely have time for questions. Because this is being recorded, or comments, please use the microphone so that everyone in the room can hear you and the people who are viewing the recording. Any questions or comments? Yes.
Good afternoon. Thank you very much for the very informative presentation. Yeah, I've attempted suicide myself since I've a number of times since being HIV positive, but also from being gay and being in the closet and the self-stigma around that, and also when I was coming out, just when the AIDS epidemic was coming, I really didn't want to be identified as that. So part of that is looking at the life course perspective from an HIV positive person, but also as a gay positive person, I think is important. And I think this stuff is really needs to be out there, because this 1 in 6 the numbers are just astounding. Like, we're actually, more people are dying from suicide than from HIV. That's remarkable that biomedical science has helped us that way, but the biopsychosocial model of wellness and the spiritual components have to be addressed as well to make us more holistic and more whole as people. And I think this is wonderful that what you're doing, and getting that discussion going is so important. And I want to commend you on that. Thank you.
Yeah, thank you. I know it's not a question, but I just want to thank you so much for sharing your story. And I think often about our participant, and I kind of who are, the reason a lot of people participate in the study, it's because they didn't want anyone else to experience what they experienced, right? So we've been actually, I didn't really talk about it today, but we've actually used the photograph heavily to try to raise public awareness. So that's why we have a book, and we've tried to give it to like policymaker, but we've also actually hosted exhibit of the photographs. So we had 3 exhibits in Vancouver, and we had one in Ottawa, as a way to kind of generate conversation on the topic, because I think, we don't talk about this topic. There's kind of like this myth that if we talk about it, people will do it, right? The same kind of thing that we say about sex education in school. You know, if we talk about condoms, people will have sex and not use condoms, which doesn't make sense, right? So I think we need to talk more about it, and we need to offer a way of doing it. And I think, you know, what we find with the photography has been a way to tell people's story. A lot of the participants that when they did the interview, which I did most of the interview, was telling me that they had never had a chance to tell that story. Like most of them had never talked to anyone else about their experience or talk about another queer person. And, you know, through the process, it was very empowering. So anyway, thank you for sharing your story.
Hi, thanks for that great presentation. I'm just curious to know if people who participated in the study, in the program, if they were connected to services at all. Like mental health services, and I'm really curious to know if they went to mainstream mental health services, if they went to like queer specific services. Yeah.
Yeah. So people had varied. So one of the thing I want to add is, like, you know, for us, for people to participate, they needed to not have like be in a crisis, right? So this was not a therapy. So it was people that had past experience, and people experience with mental health services was extremely varied. So we had people that had a lot of people had traumatic experience. I mean, there was people that had been like hospitalized against their will, and, you know, quite a few ones. So it's been kind of very traumatic. Other people had kind of had had mixed experience with counselors. So and often it was trying to find this having a queer counselor was actually seen as something extremely positive. So a lot of people wanted that because they felt that they could be more open about their sexuality, and they didn't feel that they had to explain everything. So, and this was the way that people, most people, like a lot of it was like they wanted that. That's the service that there's two main services that people really wanted. Is A, they wanted to talk to someone, a counselor that was queer, but also they wanted to share their experience with another queer person that had experienced similar thing, which is something we don't, that are more common in the US, kind of support group for people who have survived a suicide attempt. We don't have that as much in Canada, and we don't have, as far as I know, I don't know of one that's for gay and bisexual men, but maybe I'm wrong.
Great. Anything else? Okay, sorry, one more. We do have time. Come on down.
Hi. Thanks, Olivier. This is a great topic that I'm really interested in. Did any of the data skew towards age? Like, did you notice, was it older guys who had tried more? What was the age range, I guess, of the participants?
Yeah, in her study, the age of her participant varied a lot. The youngest was 23 and the oldest was 71, and so they needed a past experience. So, you know, there was very various experience where some people had experienced suicide ideation when they were, you know, like late teen, early adult. And at this time, the reason was really, you know, tended to be really around like the isolation of being gay or the bullying about being gay. And then as participants got a bit older, you know, reason became a bit more varied. And although this traumatic experience of violence always kind of linger in the background, often it was other reason. But we know from, you know, suicide, from statistics around age, you know, that suicide attempts tend to go up in teenage years, attempt, not fatality, and then but then that suicide death also go out with adult male, you know, where like we're seeing that as people are middle-aged tend to kind of have more suicide death among that age group. But it was interesting is like people, some people in our study had struggled with suicide their entire life, and for different reasons. So it was not always the same thing. So something to take also into consideration.
Thanks. The other thing was about suicide or a place to go, that kind of stuff. I work at the Men's Trauma Center as well in Victoria, so it's one of the few places in Canada, like say there, that is specifically for men or people who identify as male, who are survivors of trauma, and so we often see people who've attempted suicide, that kind of stuff. So, but it's so the next thing is, like, in terms of recommendations or whatever, great, it's fantastic we're studying this, but to help people now, you need funding. So what's the next step? Like, that's great that we've got some data. Now what, for someone who's kind of practicing it? So, yeah. You have to pay practitioners to see clients, yeah.
I know that's suicide prevention is extremely underfunded, and particularly, like, to my knowledge, there's not, like, I think there's stuff that we are doing that have an impact on suicide. Like, I think HIM's program, although HIM is not a suicide prevention organization, I think a lot of their program are probably have an impact on the well-being. You know, a lot of people in her study actually talk about going to program in queer organization as a way that were not officially suicide, but that kind of help them build a social network, meaning people that are like-minded. So I think, you know, they're doing an important thing, but as far as I know, there's no suicide prevention initiative in this country that are being funded to look specifically at the issue of gay and bisexual adult. And there's a bit of intervention around youth, and there's a kind of this myth that suicide is a youth issue, but actually there's more suicide death among probably among LGBT adults than there is with youth, but there's this framing of the issue that's always around youth about how media frame the issue, but also I think public health agencies are very responsible around that, like the Public Health Agency of Canada describe queer youth as a population at risk of suicide, but they don't mention queer adults, right? So.
Great, thank you, Dr. Ferlatte.